We are paging Dr. Paul here on CTV Morning Live, and one thing to double check is my microphone. I have my own money into the microphone jar. Dr. Paul, great to see you once again. And I was just sitting down talking, and I'm like, you know what, here we go again, runny noses,
right.
high fevers at night, and we are into not quite yet flu season,
well, that's
but
right.
definitely into the
cold season, and that's what I wanted to talk about today. We've been getting, local hospitals reporting increased number of people come to the emergency room with respiratory symptoms and cold-like fever, etc. And some people are sick for a week or two. I know that people that I know personally have been sick for a while. And what I wanted to tell people is this is a cold. It is not the flu yet. The flu hasn't come here yet. And the reason I want to bring it up is a lot of people have been telling me, well, I got my flu shot a month ago and I got a cold. Well, the flu shot doesn't protect you against the cold, unfortunately. There's hundreds of viruses that cause colds. Okay. And there's a couple of viruses that are around now.
All right. Now, how does one differentiate then between what they are, what you consider a cold, and then what we can be considered the flu?
That's a good question. Really, a cold starts off with sniffles, runny nose, a bit of a headache, maybe low-grade fever, but it stops there. It may last a couple of days, maybe about a week or two, and maybe may turn into a sinus infection, etc. But it doesn't give you the worsening symptoms of a flu. What a flu does is you really feel lousy. In other words, you have muscle aches. You have high fever, you have chills, and you can't really even go to work for a week or two. So, the risk, unlike a cold, the risk of the flu is that if it hits an individual who has an immune problem or is young or is very old, it can actually go into the lungs and cause severe breathing problems, which a cold doesn't usually do. So those are the distinctions between the two. In other words, a cold may last a week or two, but it's not potentially dangerous. In most situations, you won't end up in hospital, you won't end up having problems. With a flu, however, you'll know that you have high fever, chills, and one of the hallmarks of the flu is that it gets into your blood and then actually goes into your muscles and causes severe muscle pain. And that's one of the symptoms that we have that you don't have with a cold. So there are distinctions between the two, and not only is it that you feel lousier with the flu, and I'm not saying that people who have a cold don't feel lousy, but you feel lousier with the flu, and studies have shown that you can be out for a week or two or three, and especially, and if you've got underlying medical conditions, it's even worse for you.
One of the things is, as an adult, you can characterize the differences by how you're feeling. When you're dealing with a younger child and you're trying to have them explain to you, what are you feeling to be able to describe? The concerns would be the sore body, but also understanding at what point you're getting into the lungs, because that's the differentiation, right? Exactly.
Signs of respiratory distress or respiratory difficulties in children are sometimes difficult to point out, but you can actually, if you know your child, you know the child is having what we call labored breathing or difficulty breathing. First of all, he might be breathing quicker than normal. There might be using his or her muscles. You might have the hole here is more pronounced. There are some signs that you can see. Obviously, if the child turns blue, has blue lips, that's not a good sign either. But you don't want to end up that way. But you'll know as a parent the difference. Instinctively, you'll know. And if you think that the child is having difficulty breathing, go to the hospital, because then that's the best place for the child to go.
All right. The one thing you wanted to stress is, well, a lot of people we've kind of gone through the flu shot. A lot of different workplaces circulating. Is it still? Would you still recommend at this point?
I would still recommend it. I don't want people to think, well, I got the cold, I'm okay, I'm not going to get the flu. You can still get the flu if you don't have protection. And like I said, there's hundreds of viruses that cause colds. There's certain viruses that cause the flu, and we have a vaccine for those. So if you've had your shot, fine. If you have your shot and had a cold, well, you had a cold. Don't worry about it. Doesn't mean that the flu shot didn't work. And if you hadn't had your flu shot, it's not too late. Usually the flu season comes around probably between January and March. We don't have a crystal ball 100%, but statistically that's what we get.
All right. Great information.
Thank you.
Always a pleasure to have Dr. Paul joining us. We are going to take a short commercial break. We've got your top news headlines coming your way, including a different type of commute maybe tomorrow morning, where we have the opening of the IKEA, the largest IKEA ever, I think, on the planet. I think you could probably see this from outer space. We'll have the details on that coming your way right after this.